instead of projecting forward and to have a well-defined, sometimes chiseled, really distinguished midface. You all know that expression that the models have high cheekbones. To have that, we need definition and we need projection and we need volume. And so much of mid-face rejuvenation involves revolumization. And we do that a number of ways. The most common, or I should say easiest way, is with the use of fillers. Voluma, Belotero, Juvederm, Restylane. There are many of them, mostly hyaluronic acid base. And so what it does, it's a sort of replacement with hyaluronic acids. It's a naturally appearing substance in the skin to revolumize, and we can tend to bring the cheekbones to a more forward position, have the central part of the cheeks come forward and project. We don't want to pull and tighten the midface. That is a very done look. The other way we do that is with fat grafting. We can do a conservative amount of liposuction. We spin down the fat or decant it, purify it, screen it, surgically cleanse it, and then we can re-inject it into the mid-face. It's a sterile procedure. Small areas can be done in the office. It works. And we tend to overcorrect. It's a lot like, I tell my patients, Johnny Appleseed. Johnny Appleseed had a whole bushel full of apple seeds, and he went around spreading them throughout the countryside. Some took, and some did not. In the face, for fat grafting, approximately 67% of the volume will persist. The volume takes root and grows and becomes breathing, living tissue. It's your own cells, and it takes root and grows. So that's an important part of revolumization for the midface. Now let's specifically talk about some of the lines of the upper lip and to a lesser extent the lower lip. As part of the midface, we need to look at the perioral area. That's around the mouth, around the lips. More specifically, the nasolabial folds tend to get deep. People get vertical lines, and they tend to be called lipstick lines or barcode lines. And sometimes the lower lip gets etching as well. And so oftentimes I will treat that with fillers, sometimes fat injections, and more recently with peels. I do a lot of TCA peels. TCA peels can be quite effective. I do a perioral TCA scrub where I actually take a sterile gauze, we call it a sponge, and I'll focus and really scrub out a line in the upper lip, and it can give a significant amount of change. Perioral dermabrasion is another way we do that. Perioral dermabrasion is a way of sterile sanding. We can sand down many of those fine lines and smooth out the skin and give the skin of the lips a chance to regenerate. That can be very effective. However, it has a significant amount of downtime. With a TCA peel, nothing happens for 5 or 6 days, and then for 5 or 6 days a person will shed, and then after that period there's pinker, smoother skin. It takes about 6 weeks for the pink to fade, and you can wear makeup to hide it. So that can be effective. Laser can be effective in treating these lines. And again, I mentioned different modalities because everyone deserves a custom designed approach. So revolumization and peeling and treating the skin can be very effective for central facial rejuvenation. There's a newer peel, well, I should say it's being reborn and revitalized. It's a peel called a croton oil peel. It used to be associated with a peel that was popular years ago called the phenol peel. The phenol peel certainly works to minimize lines, but it had a bad reputation because people can get actually hypopigmentation. They can get a pale look, and sometimes it was accompanied by kind of a waxy look. The skin didn't look so natural. Although many of the lines and wrinkles and ridges were effectively treated, people had hypopigmentation and kind of a waxy kind of sheen. With the croton oil peel, the new type of croton oil peel, we can customize it. We can use a 0.1% for the lower eyelids, for example, 0.2% for the thin skin of the temples, 0.4 for the thicker skin of the cheeks, or the nose, or the lips, or the forehead, the central forehead, or even a 0.8% if we're going to get more aggressive for the so-called barcode lines, the glabella, sometimes the nose, etc. So the croton oil peel, let me talk about that for a few minutes. That's applied along with phenol. So the phenol is very good for treating hyperpigmented areas. If you have lentigos, sunspots, liver spots, age spots, a phenol solution can be very effective for treating that. What I like to do is start the peel, the croton oil peel, with a little light coating of phenol that can treat some of the hyperpigmentation. It stings at first, but then the skin goes numb. So it's a great combination therapy. It can minimize hyperpigmented areas, like, as I said, liver spots, lentigos, etc., and it makes the skin numb. And then I do the croton oil preparation applying. As I said, it's customized, 0.1% all the way to 0.8%. The thicker skin gets the more concentrated solution. That's the same as in a TCA peel. And hence, we can really get a good frosting, because that's what we aim for, a frosting that's effective, not too deep, but we want to be certainly effective, and it can be a very powerful armamentarium, especially for mid-face rejuvenation. After the peel, we apply a tape. It's a zinc oxide tape that makes a mask, and any area that we peel, we apply it to. And it stays overnight. Then we see the patient in the office, and we take the tape off. It usually comes off in one piece. It doesn't hurt really. Most people are still fairly numb from the phenol. If it's attached, if it gets stuck onto the hair, for example, that kind of stings. If a person has some facial hair, it stings a little bit. But the skin itself that was peeled does not really sting or hurt. So then we apply a bismuth solution, a bismuth paste. That's somewhat like a mud mask. We apply it to the area of the peel, and that stays on. For about a period of 7 to 10 days, we allow it to pretty much come off by itself. Then we start the moisturizing process. So a croton oil peel can be quite effective and have profound changes for significant lines, say in the upper lip, also known as those barcode lines, the etchings in the lower lip, etc. To a certain degree, the nasolabial folds. It can be effective, and it's a significant recovery period because of the bismuth mask, kind of a mud mask that people have to wear. Now, what other procedures, what other considerations do we give for mid-face aging? It's very interesting that as we study the mid-face, if you look at someone like Brigitte Bardot, she's not my patient, but we use her as an example. If you look at Brigitte Bardot in her 20s and 30s, she had a very short upper lip that was turned out, a significant pout showing a lot of the red part of the lip, very well-defined vermilion cutaneous border. That's the white roll. That's where the red part of the lip changes to the white, the skin. Very prominent white roll, very short lip, prominent philtral column, the little columns under the nose, prominent Cupid's bow. And as I said, probably 3 times already, a short lip. With time, if you look at a picture of Brigitte Bardot when she's past 60 or maybe she's past 70, her upper lip is much longer, it's flatter, there's not so much definition. Certainly there's some lines, but she doesn't have that pouty look. She doesn't have the protruding central portion of the lip. Hence, one of the most effective procedures for people, especially women, who have, with time, developed a long-aged, kind of older-looking lip, is a lip lift. How does a lip lift work? This can be done under local anesthesia, probably with oral sedation in the office. And I make an incision. It's a kind of a modified bullhorn incision. I make an incision in the alar crease and then continuing to the nostril sill. So the alar crease is right where the nose meets the nasolabial fold in the cheek. I make an incision there, and I continue it almost into the nostril, but just at that nostril sill, at the base of the columella. The columella is the central supporting structure. If you think of the nose as a tent, it's the central supporting structure, just at that junction of the columella and the lip. And then I go back into the other nostril, and then around again in the alar crease. And then I'll make another incision, kind of an ellipse, just to pick up about 4 millimeters of excess tissue in the middle. And what that does is shorten the lip, it everts the lip, so there's more white roll and more red showing, and it gives the lip a much more youthful appearance. And the scar there certainly is a scar there. It can be hidden with makeup, but in general, the incision that's made at that junction of the aesthetic units, as I talked about, right in the alar crease, and then coming around to the base of the nostrils and across the columellar labial junction. That's where the columella meets the lip. If I excise that tissue and lay the scar into there, it leaves or allows for a much less conspicuous scar, and they tend to heal very well. There's probably some temporary nostril flaring. The nostrils perhaps get slightly wider initially, but with time they tend to go back to their original width. So the lip lift procedure can be very effective in people with a longer, flatter lip that comes with maturity and aging. Now, part of those changes accompany changes in the actual maxillary bone, the bone of the midface. As you recall, the triangle of beauty, facial rejuvenation, that triangle rests upon a foundation. And I talk about the foundation is the cranial facial skeleton. But most people don't want their upper jaw moved and they don't want bone surgery. So this can be an effective treatment to sort of counteract some of these changes that we see. The midface may retrude, the angle of occlusion may change, the lip gets longer, and we want to shorten that and get the lip to turn up. That's a lip lift. Now that can be combined with fat grafting, it can be combined with a croton oil peel, etc., or it can be done by itself. Now, what about for the person with the deeper nasolabial folds? Now, certainly, some lifting procedures, especially of the midface, can soften the nasolabial fold, but that's not the primary action of a midface lift because we don't want to pull too hard. We don't want to flatten that midface. I talked about before, perhaps the older style or traditional facelift, we pull really hard and cut off the extra skin, sew up before the skin has an extra chance to bounce back. So there are other procedures such as revolumization, such as peels to treat the nasolabial folds. We can soften them with a short scar incision, something called an MACS, a max lift. We can shorten the scar and we can soften those nasolabial folds. But in general, other modalities are more effective. Sometimes I actually excise the nasolabial fold. There's a scar there that tends to blend in very well with the nasolabial fold that's remaining. There's also something called subcision. The skin at the nasolabial fold is adherent to the deeper tissues, and that's why there's a crease. And a subcision is done with a needle. I take a needle, say, closer to the oral commissure, that's the corners of the mouth, and I undermine with the needle. Undermining is like if you have a bedspread that's wrinkled and you go in at the foot of the bed and you sweep under, you loosen the attachments of the bedspread to the underlying mattress or sheet. Well, with subcision of the nasolabial fold, we sweep under and we loosen the skin, we loosen the attachments of the skin that are down onto the underlying muscles, etc. And then we can put in some fat grafts right in there. It can be effective because what it does is loosen up the creases, the nasolabial fold. We fill it with fat. It tends to smooth out, and that can be effective. These are all tools that we have in our kit, in our toolbox for central facial rejuvenation or rejuvenation of the midface. We like to lift and fill, volumetric rejuvenation instead of pulling hard and tightening and leaving a done look. If you'd like any further information about central facial rejuvenation of the midface, please call my office, 831-646-8331. 646-8661, or go to my website, drmorwood.com, drmorwood. I'm a board-certified plastic surgeon here in beautiful Monterey, California. Thank you very much, Michael Martins. Once again, this is the Doctor is in Television program. Thank you very much for being with us.